Hi, Dr. Mike Carberry here. I'd like to talk to you a little bit about how to implement regenerative medicine into your practice. So there's a lot of different ways to do this. I'm assuming that the person who's doing this is a medical practice to begin with, since regenerative medicine is a medical service. So if you're not in a medically integrated practice, you're going to have to go through the steps involved in that. Every state is different, and if you're a client, you understand that. If you're not a client, you should call AMI, and we can help you with that. But once you get the medical team in place, one of the things you want to do in your model is to get services happening, because you're really expanding your practice. Bringing on regenerative medicine is an expansion of your practice because you're bringing on another service. And remember, the three ways to increase the size of your practice or the value of your practice is to increase your prices, increase your patient base, or increase your services. When you medically integrate, because the scope of the practice expands, not your scope if you're a chiropractor, but the scope of the practice, well then you're going to have the ability to offer more services that are outside the scope of chiropractic, but inside the scope of the licensed practitioners that are working there. First thing I would suggest is make sure you have a nurse practitioner or an MD, or DO, or PA that agrees with the purpose and philosophy of utilizing regenerative medicine to restore the arthritic condition of the patient. So, you know, if you get one that says, well, I'd like to do some research, well, if they're doing that on your dime, that's going to be very expensive. You want to know that they're open to the idea, that they have something under their belt about it, or they're willing to learn it very quickly, but you have a clock ticking. When you bring on new services, that's going to increase your overhead. So let's talk about that for a minute. There's overhead and there's production. And I ask a lot of people, in an expansion of your business, which of those two numbers is more important? And I'll be honest with you, I'm surprised to hear that more than 50% of the people say that it's overhead. Well, I got to tell you, it is impossible to expand your practice or any business by controlling overhead. You could make it more efficient, but you're not going to expand it. Expansion means increased production. So increased production is definitely the more important of the two numbers. If your overhead goes from, just using numbers pulled out of the air, let's say your overhead goes from $100 to $200. Well, that could be disastrous if your income went from $200 to $205. But if your overhead went from $100 to $200 and your income went from $100 or $200 to $1,000, well then that's the best thing that ever happened to you, was doubling your overhead. So the more important of the two numbers is production. I bring that up because there's a business side to this. We know that stem cells is good for the patient. We know it improves the outcome. We know it's actually, if you do it the correct way and the way we advocate, and you do your research and your homework and you're not making misleading claims, you're working with a reputable company, that you're going to actually be compliant, and then finally you're going to be profitable. And that's important as well. If you go out of business, you can't help anybody. So being profitable is an important thing. So you got this equation, you got a nurse practitioner, an MD now on the clock. If you're following our philosophy, you're full-time medical, which means that you are a medical practice that has chiropractic as a service, not a chiropractic practice that added medical services. See, a chiropractic practice that added medical services is not an integrated practice by definition. A practice that is medical, that includes lots of services, including chiropractic, can be an integrated practice, and the way we do it, it is an integrated practice. Remember, integrated means different licenses working together on the same patient. So the idea of regenerative medicine is our bodies are fooled by symptoms. Symptoms are the last thing to show up and the first thing to go away. And we all know from treating patients over the years that when a patient comes in and says, pain just started in my back out of the blue, and what did you do? Nothing. I sneezed, now I have back pain. You know that's a chronic degenerative problem. And that was degenerating silently for years, making the problem worse and worse and worse. People instinctively know this. I quiz audiences and I say, look, you know this is true. When you get a toothache, is that the very beginning of tooth decay? Or do you have a crater in that tooth that you could park a Volkswagen in? And everybody laughs and says, it's been there for a long time. People know that. Degenerative problems take a while for the symptoms to surface. And that's true with arthritis. So when you discover the arthritis, sometimes it is pretty far advanced. And we did not have an easy method to capture some of those years back in the past. But now with regenerative medicine, you do. So you can actually catch a person up and get a degenerated joint to function again, and then doing rehab makes a lot more sense. I remember having patients come in that were so degenerated in the past that when we tried to do rehab with them, we had to use kid gloves to work with them because they were so degenerated. Sometimes we had to send the patient off for surgery because they were so degenerated. Now with regenerative medicine, we have an ability to bring that patient's joint back to a more acceptable level of function, and you have something to work with. So what I recommend you do is when you bring on integrative medicine and you bring on regenerative medicine, bring on that regenerative medicine very quickly. Here's why. If you're going to do insurance services, you're going to have to decide whether you want to be in or out of network, and both are viable, but most people choose in network. It takes time to do that. If you're in the state of Florida right now, Blue Cross Blue Shield is dragging their feet tremendously on putting integrated nurse practitioners or nurse practitioners in an integrated practice in network. That could be a legal issue, and I hope it does become a legal issue, but that's the whole thing as a side. You got to deal with that as a reality. You got this overhead now of paying this nurse practitioner, which is probably going to be the biggest salary if you're a chiropractor that you've ever paid before in your practice. So you have to get the production side going. There's no shortage of people with degenerated joints. There is no shortage of people who need regenerative medicine. So my advice would be put the regenerative medicine on first. It only takes a room and a nurse practitioner and an MA if you're seeing any type of volume to assist her in that. When you do that, then you purchase the stem cells. You purchase them after the patient pays you for them, so you don't put money out and then have the patient, oh yeah, I forgot about it, I didn't show up, and you're stuck with the cells. So they pay for them. We're very clear, these will be delivered on Tuesday, and you have to be here no later than Wednesday, or they will be no longer good because we can't keep them cold that long. And they don't miss that appointment. But you can start this service and increase your income immediately. So that helps to pay for the overhead. So that's important because when you're trying to pay for the cost of that nurse practitioner's salary, she better be generating something, and this is the easiest thing. It's really a win-win-win. You know, as far as a service goes to help the patient, I haven't seen anything that surpasses stem cells. As far as an easy service to deliver, you have to have the nurse practitioner prepared to do injections. So when you bring that nurse practitioner on, you're going to want to invest some time into her. And what we do is we recommend you get an injection course. We work with Gary Rademacher, and his nurse practitioner, Karen, is certified in ultrasound-guided injections. So she's a very brilliant nurse practitioner. She came to me years ago and said she loved the AMI model, and she wanted to be able to teach ultrasound-guided injections to our nurse practitioners. And they get continuing ed credit hours for attending that class. So we highly recommend that you go to Gary's office to get trained by Karen on how to do the ultrasound-guided injections. When they come back, because Karen does a great job in teaching them, they're usually ready to go on Monday when they return to start injecting again. And that way, now you have a nurse practitioner who's gotten some of her continuing ed credit hours under her belt. You paid for it, which is what she expected you to do anyway. She's now trained on how to deliver this service, and she's able to deliver this service in a very quick manner. And all of a sudden, now you have patients getting better, spreading the word, and bringing income into the practice. That's why it's a win-win-win. When the patient comes in, you have to educate them on this. So we like to educate patients in a dinner talk format. It gives us the ability to explain how stem cells work naturally in our body and how they actually occur. And if you've seen my video on stem cells, I'm not going to go into it here, but it's similar to that type of process. We educate the prospective patients on it, and then we offer them to come into the office. When they come into the office, they're coming in for you could charge for it, or you can have a free consultation, whatever you feel more comfortable doing. But in the medical world, we don't give any services away for free. If they stay for an exam, there's a charge for that exam, and it's either going to their insurance or they're paying cash if they don't have coverage for it. We never give away free services in a medical office. If you do that, you start to cheapen yourself, and people start to question the integrity of your practice. So don't do that. When they come in, they get the exam. The nurse practitioner will want to see x-rays. If the patient brought studies with them, a lot of times they'll have MRI studies or whatever. Certainly you can entertain looking at them, but don't think that that patient's going to expect you to read those x-rays or MRIs on the site or on the spot. Tell them you need to look at these with your team. You have explained the team meeting concept, and you want a chance to look at it, and we can have them come back as early as tomorrow to find out if they're a candidate for stem cells or not. And then you have to find out, is this appropriate for this patient? Is there anything that would disqualify them from getting stem cells? And if not, then what do you think their chances are? You also get a chance to evaluate that patient and determine, do they need rehab? If you see postural distortions and so far, and so I would say, do a full examination, take x-rays, make sure you're looking at the bigger picture. Don't zero in on just that knee, because it could be the other knee that's worse. Look at the whole picture. See if the pelvis is involved. See if the spine is involved. Do they need rehab? Stem cells is a tool to help you catch up for the years lost when they had no symptoms, but it's not going to completely fix them. If they have a postural distortion, if they have a vertebrae that's stuck, if they have a pelvis that's misaligned, you have to correct those things to correct the thing that caused the knee to wear down originally. And if they got an injury to the knee and that's what caused it, that limping probably created problems in the pelvis anyway. So you got to look at those factors as well. Look at the whole picture. Don't tunnel vision that patient. Look at the whole picture and do a thorough exam of every area that could possibly be related to this problem, because remember, you're trying to fix the function, not cover up the symptom. To me, this is the best way to do regenerative medicine. If a patient says, I can't do the rehab, or I don't want to do rehab, or I don't want the brace, just say, I understand, you don't have to do what we say, but we're recommending this because we've done this for a long time. We're experts at it. We know what works the best. We're not going to hate you for not doing the whole thing. If you don't do the whole thing, if it comes back, we'll be glad to work on you again in the future. But at least you recommended it, and if it doesn't work the way that they expected, you can say, this is why we recommended the whole program. But we recommend an entire integrated program around that rehab. If you don't have your around that regenerative medicine. If you don't have your rehab set up right away, get the regenerative medicine going and tell them you're going to recommend them for rehab in the future, and have follow-up visits. We do follow-up visits, and make sure you're measuring not just symptoms, but functional evaluations. So you might want to do the functional physical exam before you let them go. Like have them do the regenerative medicine injection, but bring them back and do a functional exam, and then a couple months later bring them back and do it again and see how much it's changed, and quantify these things so you can objectively see. We have patients have a short memory of what it was like before they got treated, and we've had times where patients or clients said they had patients come in that said they were horrible when they started, and then they came back 3 months later and they said they don't see any difference, but you see tremendous differences. If you quantify those things, you'll be able to measure, and the patient a lot of times goes, I guess I am better. I didn't realize how much better I am. So it's important that you do thorough follow-ups and thorough exams in the beginning so you can measure where that patient's at and what the progress is in the future. Remember the rule of threes. Dr. Keith Bjork, an orthopedic surgeon that spoke at our convention last year, phenomenal guy, and he said the rule of threes, he's just noticed after doing stem cells for over 3/4 of a decade that patients respond in either 3 days, 3 weeks, or 3 months. So don't feel bad if after a month they're not feeling better. If you say, you'll be feeling better in a couple days, and they're not, they're going to think you didn't do anything. So be conservative with your estimations. Look, it could take a number of months for this to occur. Sometimes people respond quicker, but everybody's different. We're going to check you in a month, then in 2 months after that, whatever your protocol is. I've seen this with family members. I had a brother-in-law who had a bad knee problem, and we injected him, and he already had one knee replaced, and it didn't go well, and he didn't want to do that with the other one. So we injected him. He'd flown in from another state, so we didn't have a chance to do rehab with him, and he wasn't getting very much better. And this went on for over a month, and I asked him, are you doing any exercise? No, I'm staying off of it. I'm like, let's add some exercise in, and I gave him a couple exercises to do. Boom. All of a sudden, he's like, I can golf again. I can do this again. And all of a sudden, he's now singing our praises because all it took was a little bit of rehab to go along with that stem cell injection, and he was off to the races. So don't forget that. Don't get caught up in the tunnel vision of just stem cells. Do the whole integrated program. Thanks for listening.